Tonight, we brought in Dr. Justin Dunn, a cardiologist with Summa Health. Doctor, thank you so much for joining us. Good afternoon to you. We want to talk to you about the very important issue of knowing CPR. Not that you would ever be in a situation to save an NFL player's life, but it saves countless lives daily in the United States and worldwide. Why is it so important that we all know how to do CPR?
Well, thanks for having me again. And you know, CPR is really the first line of defense in the setting of cardiac arrest. So cardiac arrest, as we saw, you know, again, you know, our thoughts and prayers are with the Hamlin family, of course. But you saw how quickly this happens. You know, he took a hit, you know, presumably went into cardiac arrest around that moment, and in just a couple seconds, he was out, he was down. There is not time to call 911. There's not time to get to a phone. If somebody, you know, is not available, then, you know, this is how cardiac arrest causes fatalities. And out of hospital cardiac arrest, the mortality rate is on the order of 85 to 90%.
Oh, wow.
For that reason, it's devastating. One of the reasons that the mortality rate is so high is because, you know, even if we get these patients back and get their heart pumping again, oftentimes their brain doesn't recover because it only takes a few minutes when the heart's not pumping oxygen to the brain for them to have devastating brain injury. So it is critical that if you see somebody have a cardiac arrest or suspected cardiac arrest, it is critical that bystanders initiate CPR so that they can start getting blood flowing to the brain, to the vital organs before EMS arrives. And it can then shock that patient back into normal heart rhythm.
Well, I'm sure that the players on the field, a lot of them had never witnessed something like CPR being done that close. It is not a gentle procedure. It's very violent, but it is basically just to get the heart moving, just to get blood flowing until they can reestablish that beat that you were talking about. How difficult is that to do?
Well, you do need to be firm with it. It is not a time to be shy.
Right.
You know, you put your hands kind of in the center of the chest and you push hard and fast.
You are pumping their heart.
You're pumping hard. Their heart is sitting there quivering and it is not pumping blood to where it needs to go. And so you are responsible for that as the person doing CPR. You are pumping blood to their brain, preserving that brain function until they can get the appropriate medical care.
Just incredible.
Doctor, what does it take to get certified in CPR?
Well, if you go to heart.org, the American Heart Association website, there are videos that describe how to do hands-only CPR. You know, these days, using CPR alone is usually sufficient to get the patient the care they need until emergency medical technicians arrive. You know, the mouth-to-mouth part is not as necessary. That often scared people off in the past. Hands-only CPR is kind of the standard now. And all you have to do is, if you see somebody go down, first thing you do is call 911, get help on the way, and then get your hands on their chest and just, you know, kind of use your body to really push hard on their chest. You know, 100 times a minute is kind of what we're shooting for.
Wow. It's a lot.
And physically exhausting.
Yeah,
it can be exhausting, but it is something that saves somebody's life.
Absolutely. Yeah, and parents should always take those infant CPR classes too. It's a little bit of a different procedure, a little gentler, thank God, but certainly very, very critical at the right time. Thank you so much for joining us again, Dr. Dunn. Great to have you back.
My pleasure.
Here.
Good to be back. Thanks for having me.
Thanks.
Sure.
Be safe driving home.